Hey everyone, welcome back. Today, we're diving headfirst into the red zone of clinical practice, endocrine and respiratory emergencies. These are those moments where every single second counts, and knowing your number one priority isn't just about passing a test, it's literally about saving a life. So let's jump right in. Think about it like this. In these critical situations, it's like all the alarms in the room are blaring at once. Your job isn't just to silence them all. You gotta know which one to smash first. It is all about that one decisive move that stops everything from spiraling out of control. So I want you to really think about this. When you're in a true life-on-the-line crisis, what is your very first move? We're gonna break down the one right answer for 4 major emergencies you're absolutely going to see in your career. First on our list is a severe asthma attack. Now, we're all used to hearing that wheezing sound, right? But you know what's really terrifying? It's not always the noise you hear. Sometimes the scariest thing is what you don't hear.
Okay, this is huge, and it's kind of backward from what you'd think. You'd think a super loud wheeze is the worst case scenario. Nope. A silent chest in a patient who can't breathe means there's so little air moving that they can't even make a wheezing sound. The airway is shutting down. We're talking a full-blown cold-level emergency. So what's the play? Number 1, without a doubt, is getting them a short-acting beta agonist, a SABA, like albuterol. Pronto. You have to get that airway open. And how do you know you're winning? This is the weird part. You might actually hear the wheezing get louder for a minute as air finally starts moving. But the real sign you're on the right track is when that wheezing starts to fade away. All right, let's switch gears. We're moving from the lungs over to the endocrine system, where a totally different kind of disaster can strike. We're talking about Addison's disease and the life-threatening downward spiral into a steroid crisis. An Addisonian crisis. This is no joke. It's a massive life-or-death situation. It's like the body's entire emergency response system just runs out of gas. Completely. Without that critical hormone, cortisol, the patient is heading straight for circulatory collapse. So your response has to be a 2-part lightning-fast attack. First up, you've got to slam them with IV hydrocortisone to replace that missing steroid. And at the exact same time, you're fighting off shock with a whole lot of IV fluids. You need both, and you need them now to pull that patient back. And you know what? This is where good teaching makes all the difference. The best treatment for an Addisonian crisis is making sure it never happens in the first place. You have to teach your patients about stress dosing. That means taking extra steroids when they're sick or under a lot of stress. Seriously, this teaching, it's as important as any medication you can give. Okay, staying in the world of hormones, let's talk about Graves' disease. Its big, scary complication is something called a thyroid storm. And yeah, it's pretty much a metabolic hurricane hitting the body. So a thyroid storm is basically when the thyroid just goes haywire and dumps a catastrophic amount of hormone into the body. It throws every single system into hyperdrive. We're talking a raging fever, a heart that's beating out of control, and major confusion. So, with the whole body spinning out of control, what do you do first? It's always, always, always back to the basics. Your ABCs. Airway, breathing, circulation. The heart and lungs are under unbelievable strain. Forget the fancy thyroid meds for a second. Your number one job is making sure they have an airway and their heart doesn't give out. All right, our last emergency scenario. We're looking at type 1 diabetes and its classic crisis, DKA, or diabetic ketoacidosis. And recognizing it is all about spotting a specific set of 3 clues. DKA is all about this classic triad. You gotta know it. First, hyperglycemia. We're talking sky-high blood sugar. Second, ketones in the urine. That's because the body's burning fat like crazy, making all this acidic junk. And third, those Kussmaul respirations, that super deep, fast breathing as the body is desperately trying to blow off all that acid. You see those 3 together? Bam, DKA should be screaming in your head. And hey, sound familiar? Just like with Addison's, the real power move here is prevention. You absolutely have to drill your type 1 patients on the sick day rules. That means checking their sugar way more often, never skipping their insulin because being sick makes your sugar go up, and drinking tons of fluids. This is what keeps them out of the hospital. Phew, okay, that was a lot. We just covered 4 huge crises. So now let's boil it all down into a super simple action plan you can remember in a heartbeat, focusing on that one critical first step for each. Asthma crisis, silent chest, you hit them with albuterol first, period. Open that airway.
Addisonian crisis? Get that IV hydrocortisone in them stat.
Replace that missing hormone.
Thyroid storm? It's all about the ABCs. Airway and cardiac stabilization, right away. Life support first. And DKA, your first job is just to recognize it. Spot that triad of high sugar, ketones, and Kussmaul breathing. That's the key that unlocks everything else, starting with fluids. Okay, let's look at these two teaching points together because this is so important. See the pattern here? For both Addison's and type 1 diabetes, teaching your patient how to handle being sick is a top-tier nursing action that literally prevents a life-threatening emergency. Stress dosing for Addison's, sick day rules for diabetes, they're really just two sides of the same coin. It's all about preventing disaster.
So what's the big takeaway here? In a crisis, knowing that one first thing to do, well, that's everything. The priorities are crystal clear, so now you know them. The only question left is, when that moment comes, are you ready to be the one to lead the charge?